will take or how many sessions are required for the permanent loss of the hair. We will think, why can't we have it at home? So what do you think really? Is it advisable to use it?
Okay, my personal opinion would be no, a big no. Because
Hello everyone. Laser is something that everyone used to have nowadays to remove the unwanted hairs, but there is lots of wrong practices. So stay tuned with this video because I am in Elite Medical Center to meet Dr. Sabina, who is really an expert in managing the patients who's coming to her to treat with a laser. So stay tuned till the end. Welcome you all to Salingist. As I told you, an expert with laser is with me today. That is no one but Dr. Sabina. And thank you, doctor, a lot for being with me in my video today, because laser is something that is booming.
thank you so much for having me here with you, and I hope I'll be able to answer all your questions and queries.
Sure, you're such an expert. Anyway, we'll get into detail. Doctor, actually, can you explain what is the mechanism behind this laser? What is happening to the hair and the hair follicle when we do the laser?
Actually, what happens, what is this laser all about? It's that we give different wavelengths, concentrated light, and it hits the follicle right at the root, and either it gets damaged or it gets destroyed. There are two things now. So one is that either it's damaged completely with where we have permanent hair loss, or it's not damaged but it's just mildly damaged, or it's not completely destroyed. So we have less hair growth and thinner hair growth.
Okay.
This is how it works, actually how it works. So that's why we tell patients repeatedly that you need to have multiple sessions. It's not just one session and the whole hair will go. No, it's multiple session procedure to gain the maximum benefit.
Okay, thank you so much for that. Now, from this answer, I have one more question. That is, you told the hair follicle will be destroyed.
Yes.
So, is it really healthy then?
Of course, because we are not destroying the wanted hair. It's the unwanted hair which we want to get rid of, and it's like the hair that's troubling you on your face, or it's on different body parts. Any body part can be held up. I mean, laser can work on any part of the body, but mostly we are doing it on the face, on the bikini area, underarms, legs and arms also.
Okay, in the upper lip also.
Of course, lips. That's what I was talking about. Upper lips and chin, whole face for that matter, and even the whole body can be dealt with it. And
so it will not destroy the needed hair follicles, but
not.
it will destroy only the unwanted hair follicles. So now, next my question is like, as a patient consulted you for this laser therapy, you will be telling some pre-preparations before coming for their first session of laser. What are the pre-preparations for this?
Exactly, there are a few things we want every patient to follow, and it's a must to follow these things. If a patient, we need to ask the patient about the medical history, about the drug history, about the habits as well. But the patient is going regularly for sun baths. Is the patient on some blood thinners? Is the patient taking any thing to depigment the skin, like tretinoins or vitamin E creams or anything like that? And there is a set of these queries we have with us, and the patient has to sign each and every query before going ahead with the lasers. And we also educate the patient, like you cannot go ahead if you have done sun tanning, because you will get burnt skin. And then if you are on blood thinners, there will be less of healing, there will be more of scarring if you are taking tretinoins, if you are pregnant, if you are lactational. So we have to take all the questions first, we have to confirm everything first about the medical history, drug history, and the habits as well.
So a detailed history should be taken, like they are pregnant, whether they are lactating, whether they done for a sun bath recently, whether they are taking any medications like blood thinners.
Yeah.
Okay, that's really a new knowledge for me. So the next is the post care. What are the post care that you are suggesting after laser?
Okay, so basic care is very simple. Like patient doesn't have to expose to sun. Sunblock is a must to be applied. Hot water baths are to be avoided. Sun tanning is to be avoided.
Okay, so these are the main four things.
Yes,
you are
exactly,
suggesting.
exactly. Then it varies from case to case. Like patient has some other concerns, I'll just go through with the case and I'll inform the patient that no, you don't have to do this, you have to do it like that. It depends then. It varies from case to case.
Okay.
That's why we tell the patients to go to a dermatologist or the person who has been doing it, who is a knowledgeable person, who has the knowledge of doing the lasers.
Who is an expert?
Exactly.
Really.
Like in our center, even the procedure is finally done by the nursing staff.
Okay.
But before that, patient has to consult the doctor. Like patient comes to me, I will go through I will check the skin, I'll check the hair type, then I will be the one who will decide the energy for the patient, who will decide the dose for the patient for the laser and the
Okay.
type of the laser.
So how long it will take, or how many sessions are required for the permanent loss of the hair?
Okay, it varies from patient to patient. It's not that I'll tell you that you need 6 sessions or 7 sessions. There are some patients who even need 10 to 12 sessions as well to get the satisfactory result. It's not a complete loss, yes, to get the satisfaction in what we have been doing with the patient. So minimal is 6 and up to 10, and then it depends. It depends on various factors. It depends on the hormonal balance of the patient. It depends on the medical condition of the patient. It depends on genetics. It depends on many things.
Okay, so usually it falls between 6 and 10 sessions.
Yeah. Even after that, you need to have maintenance sessions. But initially, you have to be regular with the sessions. You have to be very particular with monthly sessions till you get that level of satisfaction.
Okay, so what is the gap between the 2 sittings or 2 sessions?
Yeah, it has to be monthly sessions.
Monthly, at least 30 days gap should
Of
be.
course,
So we
yes.
cannot use it regularly because it will harm the skin.
We need the skin to heal.
Okay.
We need to give that time should be given to the skin so as to heal, because laser is damaging the skin actually. It's burning the hair follicles. So you need to, and of course there is one more important thing, that only that hair is damaged which is in the growing phase of the cycle. So if the hair is not in the growing phase, it will not be damaged, and for that we need to wait. It's a monthly cycle of the hair growth. So this hair goes through different phases till it reaches the cycle, that phase of the cycle where it can get damaged. So we have to wait for that. That's why when we give lasers, sometimes patient comes like, doctor, I'm not seeing any effect, because all the hair was not in that phase. That's why you need to have repeated sessions as well.
Okay, so doctor, the other question is, I heard that before laser we have to remove the hair from that part, whether
Yes.
it is upper lip or any part. Why it's so?
It's not actually the removal of the hair, it's shaving of the hair, because if we don't shave off the hair, there will be more damage to the skin, which we don't want to have. Like we want to damage only the hair follicle, we don't want to damage the skin. So if the hair length is long, more energy is absorbed and it can be transmitted to the skin. So we don't want that. That's why we want to hit the target, we want to hit the root. We don't want this energy to dissipate over the skin surface and damage the skin. That's why
That's
shaving
great
is a
to
must.
know.
Yeah.
Next, the crucial questions I want to know is, everywhere when you open the Instagram, the Facebook, lots of machines are available with cheapest cost like 250 riyals or below 750 Qatar riyal or something like that. And we are really forced to go and buy it because laser is very expensive.
Yeah.
We don't have the time to go for the sessions repeatedly. So we will think, why can't we have it at home? So what do you think really? Is it advisable to use it?
Okay, my personal opinion would be no, a big no, because lasers can damage your eyes. You need to protect your eyes. Okay, so if you are doing, it's not sure that you are doing it in a correct way. Here in medical centers or cosmetic centers, you have an expert with you who is just overlooking everything. The procedure is done by a second person. Second thing, the very important thing is that it's these machines have still not got the US FDA approval because they say it's for cosmetic reasons. It's not for medical reasons. Okay. So I would rather say that if you're visiting a cosmetic center for lasers and you are doing it with a proper machine, that is better than wasting your money, because you need to set that energy, you need to hit the target, and which is of course not, we cannot be sure with these machines. They will not give you the exact energy, that high dose energy. So yes, you should think about it again.
Okay, so what are the common side effects of laser? I know that if I do a laser, if you do a laser, the effect after that will be a bit different, as you already told. So side effects also vary from individual to individual.
Exactly.
So what are the common side effects?
Okay, there are very less side effects of doing laser. So, but there is something that everybody should, who is going for the laser, should know. One is that it can be temporary or it can be permanent side effect. Like temporarily, there will be redness, there will be a little rash, and it should go within 1 day, few hours to 1 day. And the more serious side effect can be scarring, can be hyperpigmentation, hypopigmentation. Okay, so to avoid that, we take a history, medical history we have already talked about. So yes, it can be avoided. It's not that surely you will get these side effects. It's avoidable, but you have to be sincere with the doctor for that.
Okay. So is there any age group, like a particular age, from that onwards we can do laser, or after age, like after 60 we should not do anything like that?
Okay, so for that I would like to tell everyone that lasers can be done even after the age of 14 years. What I personally advise patients that up to the age of 18 you should avoid doing it, because hormones are still playing. It's still coming to take the role. So if we are starting it at the age of 14 years, you will have that effect, but you don't know what are the hormones going to do till 18. How is it going to behave with the body? We have different hormones that we need to look into, is testosterone and DHEAS, and till that comes into play, they start having their own role and they start to settle down. We need to think over it, and it's safe for all ages. There is no problem. It's safe for both men and women.
Okay.
We need to avoid it around our eyes, eyebrows. Yes, we have to avoid this area because it can damage our eyesight.
Okay. Nowadays, because of the hormone, there is an excessive growth of hair seen among the ladies, among the females, especially in the chin part and in the neck region.
Yeah.
So for such kind of patients, when you are treating them with laser, are you suggesting any medications, hormonal medications along with that?
Yeah, there we need the workup of the patient. I would go for a gynecologist consultation, obstetric consultation, or endocrinologist consultation. If there is something like that, there is PCOS. Usually, yes, we are getting many cases of that, and yes, it has to be a multiple-sided approach. It doesn't have to be like lasers will take care of all the hair growth. No. It has to be, we have to keep hormones under control and we have to do the lasers also.
So both should be balanced in that.
But from my side, it will be that I will start the patient on metformin. Okay, I will give them advice regarding exercise, maintenance of sugar levels, monitoring of sugar levels, because usually they have that diabetes into they can be associated with diabetes also. So metformin is a drug given for PCOS usually to begin with, and it depends then it's the specialist advice also.
Okay, so next question is like, there are dry skin, there are combined skin, there are normal skin, oily skin. So laser is okay for all type of skin?
Yes, exactly. Laser is good for all types of skin. Just we need to take care of the color of skin and the type of the hair growth. Like, is it thick or thin hair? Is the color of the skin towards the darker shade or it's towards the lighter shade? Laser suits well if a patient has lighter shade of skin but a darker shade of hair, black towards black. And if there is darker skin shade and hair is also dark, then we have different wavelengths. We have multiple wavelengths for that. Initially, but for, yes, I'm sorry, for gray, blonde or white hair, lasers are still not effective. And so that's it. Yeah, that's it. It's
Like
more if you have
gray
lighter
hair,
shade.
it is not suiting, you mean?
No. It doesn't suit that.
So brown hair also.
Yeah, it's less effective. But now we have mixed wavelengths. So we try to hit the maximum possible hair follicles with a wide range of colors. But still, there has not been seen like much success in getting rid of gray or blonde hair. But yes, with black hair, it's very effective.
It's very effective.
Yeah.
Okay. So the last question, because we almost discussed many of the part which I love to know about, whether the patients are coming only for the aesthetic purpose or any other kind of patients or people are doing the laser.
There are different types of lasers for different types of things. This was only about the laser hair reduction we were discussing till now. With lasers, we can do many things. Like we can get rid of scars, we can get rid of post-acne scars usually, we can get rid of tattoos, pigmentations, we can get rid of acne, we can do many things, even fine lines, wrinkles, that can also be taken care of with lasers. Hyperpigmentation, dark patches, yes, we have different wavelengths, different machines for that.
Okay, so really an expert needed for the proper treatment with the laser.
Exactly.
That's the conclusion I can understand.
Yeah, it has to be with an expert advice. If you go for a laser, it has to be with that. Yes.
Okay, thank you so much, because many of my questions have clarified, and I know that many of my friends usually ask those questions to me, and I thought to make this video and really explained in an amazing way. Thank you so much, doctor.
Thank you so much. Thank you so much.
So bye bye.